Thanks, Phil. And thanks, Rhonda, Judy, and Manuel for sharing those powerful stories. Those are the stories of home care workers and our clients all across the state. And those are the stories we need to share with our legislators today. We're facing the biggest threats in long-term care we've ever faced. Threats to hours of care, threats to health benefits, threats to our training, threats to home care, to adult day health, to nursing homes. First, let's talk for a minute about why we're facing these cuts. Why is the state facing a massive budget deficit? Is it because home care workers are overpaid and given lavish benefits? Is it because we're wasting hundreds of millions of dollars on care for the most vulnerable? No. Of course not. We're facing a massive budget deficit because the wealthiest people in our country got too greedy, caused the Great Recession, because they pushed people into predatory loans and gambled with people's money.
And they're paying the Republicans to get it done, too.
That's right. But now that we're facing another massive deficit, how does the state propose to solve it? Are they asking for shared sacrifice and asking the wealthy to pay their fair share? No. Of course not. As usual, they're asking the lowest paid workers, home care workers, long-term care workers, nursing home workers, and our vulnerable clients and residents to pay the price. Rather than ask Wall Street bankers to give back their tax breaks, the state wants to slash or eliminate the basic health plan. Rather than ask the wealthy to pay taxes on their private jets, which they don't currently pay taxes on, the state wants to slash child care, GAU, and funding for education. Is it fair that DSHS management, get this, DSHS management taking a 3% cut through temporary furloughs, but they want home care clients to take a permanent 10% reduction in hours? Are we going to let them get more than that? Right. Some as many as 25% over the last 2 years.
We've been cut twice.
That's right. Are we going to let them get away with that? No! We're doing everything we can to fight back. In the courts, on the airwaves, here in Olympia. We filed a lawsuit. We've done vigils and rallies all across the state. We've been in the press about the cuts. Val from Spokane was on the radio this morning across the state. Today is about making it real for our state legislators. Legislators get a lot of paper. They get a lot of presentations about their budget, about the numbers. They have a lot of spreadsheets. What we need to do is make it real for them. Put faces and people behind the cuts. Talk about the impact on people like David. And what's the real impact of what they're proposing doing. We need to tell them what the real impact will be if they cut hours of care for our clients. We need to tell them why better training is important, not just for quality care, but so we can have a better future, so we can get training and have a career path to jobs and health care. And we need to tell them why we can't afford any more cuts to our health benefits, especially those of you at private agencies who are facing a cut to health benefits that will basically make it unaffordable. And finally, we need to challenge legislators to demand a balanced solution to the budget deficit. Not just cuts to the most vulnerable, but taking on the corporate tax breaks, like the tax breaks for out-of-state banks and owners of private jets. So can we do it? Can we stop the cuts to home care? Can we do it?